So funny story, I was actually recording the video on neonatal jaundice just a few minutes ago, and I had actually reached a very significant portion into the video, and my PC actually decided to black out on me and actually turn off, and it's actually been acting up. And I thought to myself, am I really going to do this to myself and re-record the video? That's how I actually decided to actually come up with a different video idea. So as I was going through the comments on my channel, I actually went through one particular comment that actually asked how we can actually do these daily reviews in pediatric if you're reviewing the patient on a daily basis and not seeing them for the first time, because I did a prior video on actually how to review patients when you're admitting them into the neonatal intensive care unit. So I thought this was a very good idea. So let's piggyback off that video and jump right into this video. Grab your piece of paper and let's go. Hello and welcome to MK's Medical Review Series. My name is Dr. Moses Kazevu. This is a series on my YouTube channel where we look at medical topics in depth. Today we're going to be looking pretty much about how to conduct a daily pediatric review. If you haven't yet subscribed to the YouTube channel, please hit the subscribe button, hit the bell notification icon so you never miss on such amazing content every time I post. Grab your piece of paper, grab your pen, and let's go. So, imagine this, you're fresh off from medical school and you have been posted to a certain hospital, you have been directed to the pediatrics department. The last time you were there, you were a student and you were under, of course, a junior resident medical officer or another senior doctor that was often reviewing the patients with you. Moreover, you didn't have such responsibility on your hands. Now you have been thrown into this pediatric department and you have been asked to start seeing patients on your very first day, because they wouldn't want to take you to the triage room or to the call room to start seeing patients from there. So you're seeing the patients that are admitted on the wards, and you're doing this for the first time, and you have pretty much no idea what you're going to be doing, no idea what you're looking for, and how you should actually put out your notes to make sure that at least you show some level of competence. That's how I actually thought about this topic to be specific, so that we can actually go through how to review patients each and every day, such that you can have a very good idea even when you're actually formulating your notes, and you can actually have a very clear train of thought in relation to how you take your histories, how to elicit certain things for patients that are already admitted to the ward and not those patients that you're seeing for the very first time. So without any further ado, let's actually go and give you a clinical scenario that is going to help with this particular case. So I will actually go to a whiteboard. I hope my PC this time does not really glitch, because it's been really letting me down lately. So I hope it really doesn't glitch. Maybe let me just disconnect a few things from my PC. Maybe that will help with the speed. Right, so let's go to a whiteboard. So as you can see, the mouse is really lagging, so let's open a whiteboard there. Okay, so I hope that's okay. That's fine now. So I will give you a clinical scenario over here. So we have a 4-year-old boy. So we have a 4-year-old boy, and this 4-year-old boy is pretty much going to be 3 days of admission. So 3 days of admission. So 3 days of admission. And this boy is being managed for pneumonia. So they're being managed for pneumonia, to rule out TB, to rule out PTB. Okay. In RVD. Right, and this is the significant information that you have of your particular patient. Now, the first thing that you must always do as you are seeing the patients for the very first time is make sure that before you see the patient, wash your hands or use your hand sanitizer. After you see the patient, wash your hands, because infection prevention is key to us actually limiting the spread of hospital acquired infection and also limiting the spread of infections from one patient to another, this cross infection and the emergence of resistance. So you want to wash your hands before you actually touch the patient and also after you touch the patient. Then before you start, make sure that you locate your patient file, and there are certain important things that you're going to be looking for in the file. So one such important thing that you're going to be looking for in the file is pretty much the investigations that were ordered for. Investigations. So the investigations. Another thing that you're going to be looking out for is the medication that this patient was on. Are they receiving any medication? Is the medication being given? If it's not, why isn't the medication being given? So you're also going to read through the history, the entire history, tease out the important things or the important positives and negatives that are needed or that are relevant to your history case. Then after you have done this, then you're going to have to talk to the parents. Make sure that before you start taking or writing down your notes, before you start examining any child, you should ensure that the guardian is there, that either the mother, the father, or any legal guardian is there and present at all times, because these are pediatric patients and they are underaged patients. So make sure that at all times the guardian is there. And if they're not there, then you can defer all this until you wait for the guardian. You can actually see another patient that has a guardian, and then as the other guardian for this patient comes back, then you can get back to this patient. So once you have this preliminaries actually out of the line, of course, your first thing that you're going to be doing is greeting your patient, making sure you have the right patient, introducing yourself. So building a rapport with the mother or the father or the guardian, building a rapport with the child, and make sure that at all times you're referring to the child by their name, not him, his, it. Yes, believe it or not, there are some people that may use it. So after you've actually reviewed the file, you have greeted the patient, you've gotten all those preliminaries down the way, then of course you're going to now begin to elicit your history from the patient. So I'll first give you an overview of how actually we're going to be doing it. So we're going to be, first of all, an introductory statement, a summary of the patient. You also have the medication which the patient is on, the investigations that are done, and any available results. If the patient has changed any condition, anything new that is significant, your examination findings, then of course your impression and your plan at the end of the review of the patient. So that's like an overview, a summary of what is expected of you to actually take note of whenever you're reviewing the patient. So I'll divide this whiteboard into a two section over there. So the first thing that you must actually always do, and please do not forget to do this, because a lot of people actually get into so much trouble, especially if the patient has certain litigation issues. And if, for example, the patient demises, then you haven't included what time you actually saw the patient, when you saw the patient, when was the last time you actually reviewed the patient. So believe it or not, even though this may be a very small thing or minuscule thing that you may overlook, this is very important. Always include the time when you saw the patient, always include the date and the place. So let's say you saw this patient at 10 o'clock, of course, in the morning. And this was seen on the 10th of May, 2023. And this was in the under 5 ward. Okay, so that's the first thing that you're going to be writing for your patients. Then, of course, your name at the top there. Make sure that everything is legible. So I'm going to place my name over there. Okay. Right. So there we go. So remember that the first opening statement is that you have actually seen the patient or you are reviewing the patient. So some people actually love to actually say patient reviewed. Some people actually like to say patient seen. So usually I love to say patient seen. So we put a point there, say patient seen. Then we state whether this is either a boy or a girl. So this is a male. That's 4 years. So the male, 4 years. And then how many days of admission have they been admitted? So maybe this is day 4. This is day 4 post-admission. So it means that this child has been on the ward for 4 days. This also gives you an indication of how long this child has actually been on the ward, and if there's actually any significant improvement, or if you actually need to change anything in your management plan. Remember that every time you see the patient, you must at least be doing something new for the patient. Of course, it may be something very minimal. If for example, the condition has remained static, then maybe you can investigate them and try to pick out something that you have actually missed in the previous days. So this is day 4 post-admission, and then you tell us what exactly this patient is admitted for. So this is a patient that's going to be admitted. So some people say they're admitted for, or some people actually say that they're being managed as a case of. I like to say admitted for. So they are admitted for pneumonia. So they're admitted for pneumonia, to rule out PTB in RVD. So notice how we have now brought in the RVD into the picture. Now we want to find out how long has this child been reactive. So the next statement is going to be quantifying or justifying this RVD that we have actually introduced from this patient. So we can say that patient has been RVDR since birth. Okay, since birth. Then now, if this patient has been RVDR since birth, the next question that you're asking yourself is, has the mother been on treatment? Is the mother taking? Are they virally suppressed? Is the child on treatment? Okay, so since birth, then the next thing is, if the child is on treatment, are they being treated for this or not? So child currently on treatment. Now, what treatment is this child on? So you can even put this in brackets. Suppose this child is maybe on AZT, they're on 3TC, and they're on, let's say, boosted lopinavir for some reason. Okay, so that's the treatment that they're on. Then, was this child born via C-section or SVD? You can actually include that in your history, in your review, because this is a very important thing. So born via SVD. Mother not on treatment. Okay, so mother not on treatment. Now I've taken care of the RVD and the aspects in relation to the RVD. The next thing that we're going to be doing is, maybe let's try rule out the TB. Why are we suspecting TB? So we can say that maybe from the day that this child was admitted, they had a positive history of living with someone who was actually being treated for TB. So we can just say that positive contact, a positive TB contact in the past year. Okay, so now this positive TB contact that has been there in the past year, we can also actually qualify it and say this person was smear positive. That's if we ask the history and we find out the details. So they were like smear positive, and received treatment. Received treatment for 4 months, or actually 6 months, for 6 months at that time, for 6 months. Okay, so it has taken care of that. The other thing that people actually, this is like a summary of the patient, so I've really summarized everything that is important from the history. Another thing is that the symptoms in which this child has actually come in with. So we can just add that as the last statement. Came in with 4 days. Came in with 4-day history of shortness of breath, cough, and fever. So they came in with a history of shortness of breath, a cough, and a fever. So this is what has actually brought them to the hospital. Then the next thing that you're going to be asking this mother, or as you are interviewing the guardian, is, has there been any significant improvement since the time the child has come? So the mother notes improvement. Okay, notes improvement in child's condition. In child's condition. So the mother notes some improvement in this child's condition. And is there anything new? Are there any new complaints that the mother is raising today? So there are no new complaints raised. No new complaints raised. Okay. Then we ask ourselves, have they done any investigations pertaining to this child? Were there any labs that were taken? And for sure, if labs were taken, what do they indicate? So let's say FBC. So we now review the labs. FBC shows neutrophilia, and you can even add the value here. Let's say it's around 12. That's the absolute value. So it's around 12. Shows neutrophilia, and it also shows thrombocytopenia. Then we can even add the value here. Let's say 78. Okay, let's say 78. So that's what the FBC was done. Then let's say if the chest x-ray was done as well. So chest x-ray shows consolidation in right upper lobe. That's assuming that you have actually looked at the consolidation and you have actually looked at the x-ray. So you should be conversant with how to actually interpret these x-rays. Then you can even go ahead and state the labs that are not really yet done. So our sputum MCS, and ESR not done. ESR results not ready. Okay, so it means that we've taken care of the labs and everything that was actually ordered for this particular patient. Then the next thing that you're going to be asking yourself is, what is this patient on? What drugs are they actually taking? So this patient is currently on Expen plus Genta. So you can even state the days in which this patient is on Expen. So let's say if they are about 3 days on Expen and they are 3 days on Genta, you can actually count these days on the drug chart. You can count how many doses they've received. If they've actually missed any doses, you can actually include that into your history, that this patient has actually missed a certain number of doses in the on the drug chart. Then again, now that you have looked at the drug chart, the other thing that you want to check is, are they still having fevers? What are the temperature? What's the temperature? So remains hypirexic as per chart. If they're hypothermic, you're going to be taking note that no, this patient is hypothermic. So they remain hypiretic as per chart. You ask the guardian again, are they opening bowels? Are they not opening bowels? Then of course, if they're opening bowels and they're passing urine, you note that they are opening bowels, and passing urine. So they're opening bowels and passing urine. Okay, so that's like an important summary of the patient, and you're going to be giving your summaries like this of the patient as you're reviewing, because you're not going to miss out anything. You're first tackling what this patient is admitted for, anything significant past in the history, any new complaints today, are there any new results that you have? If there are new results, you're tabulating these results. Any results that are pending, you're tabulating, such that whenever you're now formulating your plan, you know the things that were already ordered for, you know what you're going to be ordering for. Is this patient having any fevers, any temperature spikes? Is this patient opening bowels? Is this patient passing urine? Then the next thing that I love to do, of course, everyone has their unique way in which they review patients, but I find this way to be very exhaustive and an easy way for you to actually get used to taking the history on a daily basis so that you don't miss certain things. Then, of course, the next thing that you're going to be doing is your vitals. So, of course, you record your vitals. So you're going to be recording your temperature, you're going to be recording your pulse, you're going to be recording your SpO2, and if you have RBS, you're also going to be recording your RBS. Okay, not RSB, but rather RBS. After you record your vitals, then you can now record your examination findings. You're going to be recording your examination findings. Anything abnormal, you include that. Remember that you must examine the patient each and every day in totality, and you must carry out a thorough examination each day because patients do change from day to day. So do not just assume because what you found the previous day, you may get the same thing the next day. It doesn't work like that. And afterwards, you write your impression, what you think this may be. If you want to maintain the same pneumonia, if it's resolving, you indicate that this is a resolving pneumonia. So always make sure that you have an impression on your history. Even if it's the same impression that you're carrying on from the previous day, you can maintain the same impression. If it's a different impression or there's something new that has shown up, then you can indicate that there's something new that has shown up. Then your plan. So your plan now is based on how well you have actually reviewed your patient. You are able now to know what exactly you can order for, what exactly you should follow up for, and how exactly the medication, whether you either escalate the medication or de-escalate the medication. Suppose if this child that we're having here, as our hypothetical scenario, actually came back with a positive sputum result for GeneXpert for TB, it means that we would then have to stop the X-pen, would have to stop the Genta, and then of course would have to start them now on the ATT plus your pyridoxine. That's the fixed dose combination therapy. The antituberculous treatment is not really four is for a certain weight, so you'd actually also have to check the weight of the child and actually look at the weight bands and how many tablets they should actually take. So it means your plan changes in that aspect. For example, if you notice that the saturations haven't really been holding, or the patient is still in significant respiratory distress, you can put them back on oxygen. If you notice that this patient is comfortable, then you can wean off the oxygen rather slowly, so that you, in this way, as you're reviewing your patient each and every single day, you're doing something new for the patient. And this is actually a summary of how to review patients. You can use this schematic actually to review all your patients, whether you're in general pediatrics or whether you are in NICU, and you'll find this to be a very, very important aspect of daily patient reviews. And I really hope you have enjoyed this video. If you did, consider subscribing to the channel, hit the bell notification icon to be receiving notifications of such amazing content every time I post. To Zambia and beyond, my name is Dr. Moses Kazevu. Until next time, bye-bye.